We're talking about a global threat, a disease that can be life-threatening, and it all starts with something you can't even see, a single parasite delivered by the bite of a mosquito. This is the story of malaria, a tiny microscopic invader that has a huge impact on our world.
So, to really get a handle on this, we're going to break it down. First up, we'll answer the big question: what exactly is malaria? Then, we'll zoom in on the microscopic culprits. After that, we'll follow the parasite on its pretty complex journey through the human body. And finally, we'll look at how we fight back, both treating the infection and trying to break that cycle for good.
All right, let's start at square one. Before we dive into all the microscopic details, what are we really talking about when we say malaria? What does it look like on a global scale?
Okay, so at its core, malaria is an infectious disease. But here's the thing, it's not from a virus and it's not from bacteria. It's caused by a tiny parasite from the plasmodium family. And it needs a getaway driver, which is a very specific mosquito, the female Anopheles. And yeah, it has to be a female because they're the ones that need blood for their eggs. Once that parasite gets inside you, it makes a beeline for two main places, your liver and your red blood cells.
And when that infection really kicks in, you'll know it. The body's response is just brutal. Think about these waves of high fever, followed by intense, bone-rattling chills, and then drenching sweats. On top of that, you got headaches, total exhaustion, and muscle pain. It's an absolutely debilitating experience, and it's a sign that the parasite is literally at war inside your body.
Now, this isn't some kind of random lottery. Malaria has its hotspots. It absolutely thrives in tropical and subtropical climates, and that's because those are the perfect conditions for the Anopheles mosquito to breed and survive. It's no surprise, then, that places like Africa, South Asia, and South America are the ones that carry the heaviest burden of this disease.
Okay, so now that we've got the basics down, let's zoom in a little closer. We need to properly introduce the two main characters in this story: the parasite that actually makes you sick, and the mosquito that acts as its, unwitting taxi service.
And this is a really important distinction to make. The mosquito itself isn't the problem. Not really. It's what scientists call a vector. It's just the delivery truck. The real cause, the actual invader, is the plasmodium parasite. The mosquito just picks it up from one person and drops it off in the next, making it the critical link in this whole chain of transmission.
And here's another thing. Plasmodium isn't just one single parasite. There are actually 5 different species that we know of that can infect humans. And while they all cause malaria, they are definitely not created equal. Some are much, much nastier than others.
And if you're going to remember one name, make it this one: Plasmodium falciparum. This is the big one. It is by far the most dangerous of the bunch. This is the species that causes the most severe cases of malaria, and if you don't treat it, it has the highest chance of becoming fatal.
Okay, so we've met the villain, but how does it actually do what it does? This part is honestly fascinating. Let's trace this parasite's incredible and kinda destructive life cycle, step by step.
So this parasite's life cycle is like a multi-stage invasion plan. It all starts with a bite, right? But the parasites don't attack right away. First, they go into stealth mode. They travel to the liver, where they hide out and multiply like crazy. Then they launch the main assault. Thousands of new parasites flood the bloodstream and start hijacking our red blood cells. And look at step 4. This is the key. They multiply inside the cells until they burst them open, and that's what causes those classic malaria symptoms of fever and chills. And the last step? It's genius, really. Another mosquito comes along, bites the sick person, and picks up a whole new army of parasites to start the cycle all over again.
Understanding that cycle is so important because it's the key to figuring out how we fight back. So what happens when someone is infected? How do we launch our counterattack?
The strategy here is pretty direct. The goal isn't just to make someone feel better or manage their symptoms. The goal is a complete and total wipeout of every last plasmodium parasite from that person's body. If you leave any behind, the infection can just come roaring back.
And to do that, we have a whole arsenal of anti-malarial drugs. The frontline treatments, especially for that really dangerous P. falciparum strain, are what we call artemisinin-based combination therapies, or ACTs for short. That combination part is crucial because they use multiple drugs at once to hit the parasite from different angles and get around drug resistance. You might have also heard of older drugs like chloroquine or quinine, and those are still used too, depending on the situation.
With malaria, time is absolutely everything. The faster someone gets diagnosed and starts that treatment, the better their chances are.
Any delay just gives the parasite more time to multiply, which can lead to severe malaria, and that means organ failure, brain damage, and other really life-threatening complications.
But, of course, the best way to fight malaria is to not get it in the first place, right? So that brings us to our final section, all the different ways we try to break that cycle of transmission before it can even start.
One of the most simple yet incredibly effective tools we have is the insecticide-treated net. The Anopheles mosquito likes to bite at night, so sleeping under one of these nets creates a physical barrier. But it's also treated with insecticide, so adds a second layer of defense, either killing or repelling any mosquito that dares to land on it. Another really big public health strategy is something called indoor residual spraying. This is where teams go and spray a long-lasting insecticide on the inside walls of houses. See, after a mosquito has a meal, it often goes to rest on a wall to digest. If that wall is treated, the mosquito gets a lethal dose, and it can't go on to bite anyone else. Pretty clever.
Now, beyond those big public health programs, what you do personally really matters. And it's pretty much the basics. Using a good mosquito repellent on any exposed skin and wearing long sleeves and pants, especially around dawn and dusk, because that's when these mosquitoes are out hunting.
And the toolkit is always growing, which is fantastic news. It includes things like preventative medications for people traveling to high-risk areas. It includes simple community action, like getting rid of stagnant water where mosquitoes lay their eggs. And, really critically, it includes amazing scientific breakthroughs, like the world's first malaria vaccines, which are now starting to protect the most vulnerable kids.
And this really sums it all up perfectly. There's no single magic bullet for malaria. The only way to win is with a combined, relentless effort. Using nets, using sprays, making sure people can get diagnosed quickly and get the right medicine. It's this all-of-the-above approach that truly makes a difference. Which brings us to the final, biggest question of all. We understand this parasite, we know its tricky life cycle, and we have more tools than ever to fight it. So, with all that, with continued effort and innovation, is a world without this microscopic invader finally within our reach? Can this cycle be broken for good?